my name is Addison, and I'm on the negative side, addressing the downside of my opponent Evan's statement of national free healthcare system. Sorry. Although Evan makes the healthcare system glorious and beneficial, considering everyone has access to medical treatment they do need, they can visit the doctor anytime, any given moment, and know that they're going to receive the treatment that they need to get better, to be able to actively go to work, tend to their families, and stuff like that. It sounds all beneficial, but it may create a devastating outcome that America is not ready to conquer. Yes, we're one of the advanced countries with technology and weapons, but many American citizens are not financially stable to pay off more taxes. Our medical billing is to pay for nurses, doctors, medicines, and more medical supplies. In order for those to be paid, taxes will have to increase. This website, thebalancedmoney.com, states that the top 50% taxpayers paid 97.1% of all federal income taxes in 2018. And among those taxpayers, the average income tax rate was 14.6%, and the average tax paid was $20,663. To put in consideration that some of the families might be in debt of car insurances, colleges, house mortgages, and more, and adding more taxes would drown families in a stress of money problems. So as you mentioned, that the COVID-19 medication wasn't available for those who are in need due to insurances policies and them not having the money to cover that. However, a year after the outbreak, I want to say, Rite Aids, different places, such as schools, like my school that I graduated from, and local areas were forming events for people to get the COVID-19 vaccination, to ensure that the outbreak wasn't spreading. And I know that I'm adding this, even though this might not seem like it's backing up my argument. However, I want to say that this idea could work in cases of situations like this, where we have a disease that's out of control, it's killing people, it's shutting down schools, it's striking fear into people. Let's solve this as soon as possible, and giving it out for free and having us paying it off with their taxes is beneficial. But when it comes to all medical care, it's a problem. And confirming by CDC.gov, stated that the COVID-19 vaccination was only free because it was paid through taxpayer dollars. Okay. So additionally saying that the government deciding that the American people, is eligible to have free healthcare system could back up hospitals and medical clinics, because everyone have the luxury to go to hospitals. However, those who are in real need for treatment are still putting their lives in danger because of the scheduled wait times. The wait times would increase. Just imagine how many people find out, or it's announced, or the government announced, like, hey, anybody is welcome to get the treatment they need without having to pay any costs. Our hospitals will be backed up with people who wants to get better, who wants to go to work, and wants to get to be more active in our community. Like, there's a lot of reasons why people want to be healthy. Of course, healthy is number one priority. But on top of it, it would reduce the chances for a need for a good doctor, stated the website modify.com. Health consumers cannot easily find a good doctors. Consumers rely on uninformed online reviews that can help with assisting traits like friendliness and wait times, which has nothing to do with medical skills. But these platforms do not offer critical information, such as information with health conditions consumers may be facing, and the right doctors with skilled treatment those conditions, and how to assess physician skills level is in helping them with their health maladies. And just like I said, it's basically saying that most people won't know if the doctor's well suited to accommodate to their issue, their health issue, the illness, whatever it might be. They won't know. Doctors, and on top of it, I feel like doctors shouldn't be reviewed based on stars or what are reviews. Most doctors go to school for years on end to be in the field that they are. They work their butts, and honestly, doctors get paid a lot because they earn that, and that's just a biased statement, and I want to confirm that right now. Another way to view this, think about the doctors that receive little compensation, as I just mentioned. That means some doctors will have to consider their own costs and results. They may spend less time with their patients and billable hours and reducing the personal costs of providing care. So there's just things that might even harm the patient itself. So to conclude, a universal healthcare system sounds beneficial and a way to build the economy. Giving every opportunity to be healthy so they can tend to their psychological needs is important. 100% agreed. However, it's important to be aware of the consequences. Although healthcare is insurances has deficiency as it is already, as you mentioned, even Evan, about most people are injured, can't go to a doctor because they can't pay off their insurances and they're in debt. And yes, but the universal healthcare can result in destroying more lives than it's intended to. Universal healthcare may be beneficial to citizens who are in need of medical assistance, but in the long run, it will hurt the fundamental of the medical field that is installed to help us. And once we ruin that, there won't be good doctors treating patients, and there won't be enough nurses checking in on patients, and medical supplies and technology would not advance in time to be beneficial for those who needs it. So, thank you for listening.